Guys, welcome back to Medical Coding with Blue. Today we're just going to play catch up and going to talk about some different topics that have been coming to light on some emails I've been getting. I also want to talk about a coder meeting because we all know I love my coder meetings. A coder meeting that I was in on today. So let's go ahead and get started. So one of the questions that I got was about vaccines. A viewer wrote in and asked, do you have to get vaccinated if you are a medical coder? It depends on the setting of where you are. If you're working at a company that you're working from home, this may not be a big deal. But if you are working in a hospital, some hospitals require all of their employees to get like the flu shot, okay? Unless you can get a clearance, a medical clearance or something, or it just find out with your facility if you're allowed to refuse this, shot if that is what you're concerned about, getting shots or things like that. Some employers, it just depends on where you are. Even if you don't have direct patient contact, you're still working in a hospital, so they want to make sure that all their employees are protected. Now it depends, and I understand everybody's different on their views about vaccines. Okay, I'm just relaying a message. Okay, it just depends on where you are. For us, that we were in the administrative side of the house, we were housed in a separate building and we were not in the hospital before. So we were allowed to say, we could just refuse the flu vaccine if we had a condition, or there was just something else going on or whatever. Now that we're in the hospital, we're around enough patients now that just going through the hospital that it is still an issue. I personally don't refuse the flu vaccine anymore because of my asthma, and even my doctor is like, it's very important that you get the flu shot because you are at increased risk. I have had the flu and pneumonia and bronchitis all in the same year because of my asthma, and it's just like it just snowballs, for me. It just like I just go all in. It's not funny, but at the same time, it's just like I have to make light of my own condition. But yes, if you have a medical reason why you can't get vaccinated, then that's something you need to talk about with your employer. It just, like I said, it all depends on where you work. But yeah, that is one of the things that is, you're working in the medical field. So it's just one of those things. So ask questions, ask, wherever you're applying, if this is a requirement, or what can you do if you don't feel comfortable getting vaccinated, or whatever the reason, whatever the case may be, just be sure to ask lots of questions. Okay. So enough about that. So the second thing was about clinical documentation improvement. So we all know how I enjoy sitting in on coder meetings. The topic for today was about clinical documentation improvement. Now, what is that? It's just like it sounds, clinical documentation improvement. It is about, drawing out those details and making sure that all those details are documented by the provider, so that, it decreases the number of queries that the provider is getting. It gives a more accurate picture of what is going on with the services that were provided for that patient on that day with that provider. And it's more detail on the diagnosis, down to the detail, like tobacco use. Okay, if a provider documented tobacco use, a clinical documentation improvement specialist, if you have one on staff, that's wonderful. But they would be able to look at that documentation and say, okay, doc, you have here that the patient is a tobacco user. What kind of tobacco user are they? Are they a cigarette smoker? Do they do vape? Do they do dip? What particular kind are they? Are they dependent, or do they only smoke or use tobacco products when they are drinking? That is actually a thing. I didn't know that was a thing until I started being a coder. There's some people that only use like cigarettes when they're drinking, or they only smoke socially. So it just depends on the patient, and this is a good example of what, that more detail would look like. Is a provider doing tobacco cessation counseling? If they are, how long are they doing this tobacco cessation counseling for? The minutes is actually very important to know, because the code description reads greater than 3 minutes up to 10 minutes, and then there's another code that reads greater than 10 minutes. So knowing that detail of how many minutes were spent doing tobacco cessation counseling is very important, because it does affect which code gets picked up. So again, a clinical documentation improvement specialist will be able to look at it and say, oh, okay, well, how many minutes did you spend on this? It reduces the number of queries that the provider is going to get. It, like I said, it gives a more accurate picture of what's going on with that patient on that day with that provider. I have to, my journey as a medical coder has obviously evolved from the time that I very first started till now. So if you're familiar with my videos, or if you've seen all of my videos, I do talk about Dr. X, who is an excellent surgeon, and he is actually very instrumental in the fact that I am very detailed now, or that I push for that detail. So, story time. A few years ago, we had he's an administrator in our hospital, and he would walk around, and his job basically was like a liaison between provider and nurse, and provider and medical coder. So his questions were like, well, what makes you happy? What can we do to, make it easier for you? What would you like to see, in the hospital? And so this administrator was talking with Dr. X, and he said, well, what would make you happy? And so he said, well, I would like, more feedback from the coders, because I don't know what's going on with my documentation, and, am I documenting everything like I'm supposed to, And he's like, oh, yeah, sure, that shouldn't be a problem. And when he came in, and this administrator came and found me, he said, who is the coder for, Dr. X, And I say Dr. X because I don't want to say his name. But I said, oh, yeah, that's me, Why, what's going on? And he's like, well, he said that, you don't talk to him, and, he would like to get more feedback from you. And I'm like, what? I'm like, he said what? Because I had emailed him before, and I had told him, hey, good job on documentation for this, and, and that was it. I didn't really communicate with him very much at that time, because I thought that none of the providers wanted to have anything to do with me. And that was my own thinking, there wasn't really anything behind it. It was just that I was just very shy in the beginning, and not thinking that they wanted, my feedback, or they wanted to know anything that I had to say, So, when I heard that, I was just like, was shocked, because I was just like, really, like he said that, and I had told him before that, he did really good, and, and his documentation is really good. I mean, like, what more does this guy want, And so I was like, oh, really? I said, well, you know what? I'm going to go fix this right now, So I go and I talk to him, and I, say, hey, I said, so I heard from a little birdie that we have a problem with my communication, And he's like, well, no, I just would like to know what other things can I do to make my documentation better? And I'm thinking, your documentation is really good. What more do you want? And he's like, well, I just wondered what is it that the coders are looking for? What are you looking for? And so it's just like, okay. So that was what opened the door to a lot of communication. And that's when I started learning about, more about CDI, and just making it okay for me to ask questions. So, if you do not have a CDI specialist in your hospital or in your area, it does sort of fall on the medical coder. As medical coders, we wear a lot of hats, And that is one of the things that we do, is we have to question, what are you doing here? This is why whenever I get a new provider in, I will sit down with them and ask them, what does a typical visit look like for you? What goes on in a visit? And they start to tell me and things like that. And sometimes they'll say, well, I do. I'm just giving tobacco cessation as a example. Well, I do tobacco cessation counseling. Okay. Well, how long do you spend talking with this patient? Well, maybe 5 minutes or so. What do you talk about when you're talking about tobacco cessation? Well, I tell them about the impact on their health. If they have osteoporosis, this. I mean, obviously, smoking is not is bad for your body, but if you have a bone condition already, and then you couple that with being a smoker, it's an issue. So I said, okay, well, when you have these discussions with these patients, are you telling them about what the resources are? What are you telling them? Yeah, I tell them about that they need to talk with their PCM about maybe getting on a tobacco cessation program, or maybe getting a prescription for something to help them to facilitate that cessation. I said, okay, well, this is a good opportunity for you to make sure that you're documenting all of this. Oh, well, I said that I do tobacco cessation. Okay, but you're not giving me a detailed description of what's going on. That is all going to be able to, justify the use of this code. And so it's just like, oh, okay. So this is sort of the things that, CDI people do, and like laceration repairs. Okay, there's different layers, and you have to get the measurements. And how complex was this repair? Did they go down to the muscle? Was it down to the tendon? You know what I mean? Was this just a superficial repair with just like the subcutaneous? These are the things that a CDI specialist can look at the documentation and say, okay, well, this is missing. What were you doing here? And so it helps a provider to know what needs to be documented. And as I said, if you do not have one in your facility, this is when you got to step in and pick up that slack. I heard an offhanded comment today from one of the coders, and she did say, well, we need somebody to come in and just do this training with these providers. Okay, why can't you do it? I mean, why can't you ask your provider, what they're doing, if we don't have this in this facility? We don't have this in our facility, so it falls on the coder. Sometimes it falls on the supervisor. It just depends on what's going on. I know for me in my instance, and of course you're not always going to be able to communicate with all of your providers, because sometimes the provider doesn't want to deal with the coders, and so it is just a matter of that particular provider. So this is when maybe like your supervisor has to step in and help and say, okay, well, if the provider didn't want to listen to the coder, well, maybe they'll listen to somebody that's a little bit higher, and maybe we can work it out that way. It all depends. Again, it depends on the relationship between the coder and the provider. This is why I always insist on making sure that I try to have the best relationship with all of my providers. I can tell you little nuances about all of my providers. I can, because I make it my job to make sure that I understand what's going on with each one of them. And as a result, I've been able to increase my production, because everything that I need to see is there, and they know that if they start to do something new, like a new procedure or something, they immediately come to me and tell me, okay, well, I started doing this procedure, and I have to sit there and ask them, okay, what did you do? What is the purpose of this procedure? Why is this new, and things like that. So those are questions that you can sit there and ask and talk about with your provider to make sure that everything's being documented like it's supposed to. They need to know that you're there for them, okay? Now, obviously, if you are very fortunate and you have a CDI specialist in your hospital or your doctor's office, that's wonderful. Of course, you want to respect the hierarchy and go that way. So if it's somebody else's responsibility to do that, then of course let them know, especially if you keep seeing issues with the documentation, because sometimes not all CDI specialists actually work with documentation as much as the coders do. So if that is the case, talk to the CDI specialist so that the CDI specialist can talk to the provider. But I'm glad that I'm glad in my instance that I don't have to deal with a middleman like a CDI specialist, even though it is great to have one. We had a physician champion come through a few years ago, and a physician champion in my facility is a CDI specialist, essentially, for providers. He was basically a doctor who really loved medical coding, and so he was able to speak doctor to other doctors. Another little thing that I got from Dr. X was communication. He's like, well, doctors can speak to other doctors, but that communication between doctor and coder is different. And I said, yes. And then he goes, so what's so good is I understand you and you understand me. So if you need me to translate what you're saying, I'll do that. So that was essentially what he does. He still does it now, where I will say something in a meeting. He will literally repeat what I just said, and then you can see the light bulb go on with some of the providers. So sometimes it's how things are explained that has a lot to do with it. But this, like I said, it's a very good working relationship that you have with these doctors, especially when they are as engaged as I am lucky to have with Dr. X, where he says, I understand what you're saying, you understand what I'm saying, so let's get this communication going. So it is very important to know how to effectively communicate. This is why in a lot of my videos I talk about communication. This is why, because you can do all of these things. You can have good relationships with your provider. You can help to make the documentation a lot better by simply communicating, what is going on, and knowing that if you're putting out there that energy of, well, these providers know that they can come to me and ask questions, they can come and talk to me, that's good and it's positive. And sometimes you may say, well, Bleu, my providers do not want to listen. And they are going to be out there. There are some providers that just absolutely do not want to listen. And they are very defensive right away. And they just say, I'm not doing it. I've been there. Several times I have been there. But you just have to sort of be patient with them and sort of work with it, because you really don't know what sort of exposure they've had to other coders. And not all coders are created equally. I say this a lot because sometimes there are coders that will just look at whatever's there and just code whatever's there. And yeah, if that is the case, then, okay. But if you're having to sit there and query, it's a good time to talk to the provider and say, okay, well, what's going on? Why are you missing all of this information? This is a standard practice when you are, for example, doing laceration repair, or when you're doing tobacco cessation counseling. These things have to be documented. If you are working with evaluation and management levels, why are you not hitting bullets enough to hit a certain level? And eventually, I will be doing videos about evaluation and management, because that's another one of my favorite topics, is evaluation and management. But one thing at a time. Again, back to what I was saying about clinical documentation improvement. This is just, it is all about communication. Essentially that is what it is. and to hear somebody say that, well, we need somebody to come in. Well, again, take initiative if you are a coder. It is an important part of it. Don't be afraid to ask questions, and if you don't talk to your providers on a regular basis, and you can start to develop those relationships, because somebody has to make the first step. Somebody has to be the first one to say hello. I always insist every time a new provider comes in, I insist on meeting them. And I always tell, like, the clinic administrators or the people that work in the clinic, hey, if there's a new provider that comes in, you guys need to give me an email, let me know, because sometimes I won't know that a new provider came in until they start seeing patients. Because at my facility, it takes a minute, for them to get everything all set up, and they got to go through new provider orientation and, things like that. Well, by the time I know it, they've been there for a month, and then they start seeing patients, and it's like, uh-oh. So this is why I try to always make sure that I communicate with everybody as well as I can, because, having that good communication is going to make you, or it's going to break you. You got to have good communication, coders, you do. And it's very important. It's going to make your life much easier if you learn to effectively communicate, because, like I said, it's not all about being able to code. It is about being able to effectively communicate. Okay. And if you do, like I said, if you do have a CDI specialist, learn to work with them and talk with them, talk closely with them, and tell them what's going on, So those are my thoughts for today, and getting long-winded. But I will be back tomorrow for Quiz Friday. So I hope you all have had a very great week, and I will see you all tomorrow for Quiz Friday. All right. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right. I will see y'all tomorrow. Bye.